Hi, everyone. My name is Swad, and I am the Program Associate for the Global Mental Health Program at Grand Challenges Canada. Thank you all for being here today. I am also working on this new initiative that has been launched called Being. Thank you for joining us today. And just as a reminder for anyone that is joining just right now, if you can please keep your videos off, and we have muted all participants just for the sake of bandwidth, given that we have a large number of people on the call. I do want to let you know that we also have a few other members from the Grand Challenges team on the line. We have Deb and we have Nicole, who you'll have the opportunity to meet during the Q&A section. Before we start, I want to let you know again that we are recording this session and it will be made available to you after the webinar. Just for the sake of bandwidth, I will also turn this off. The slides will be sent to you after the presentation. And before we also have muted everyone, and we've asked everyone to disable their video function to limit interruptions and make things easier for those with limited bandwidth. You can feel free to ask any of your questions at the bottom of the Zoom chat. So you can ask all your questions throughout the presentation, and my colleagues will be happy to answer. For any questions that don't get addressed immediately through our chat, we're happy to answer during our Q&A at the end of this presentation. But we can also post our Q&A on our website and share it with all participants after the call. So for those questions that don't get addressed on the call, we will be sure to answer it after the call, okay? We do encourage all questions, and we can get started. Okay, so for today, we will be discussing a number of items, including overview of Being, the new mental health initiative, overview of the request for proposal and objectives, key funding details and eligibility criteria, scope of work, submission requirements and evaluation criteria, tips and key dates. And then lastly, we will have, we hope to have about 30 minutes for a Q&A period. So Being is an international mental health initiative that was launched last week to fund and support research and innovative approaches that improve the mental well-being of young people aged 10 to 24 in low and middle income countries. The initiative is hosted by Grand Challenges Canada in partnership with Fondation Botnar, United for Global Mental Health, and Global Affairs Canada. Being will support research collaboration and community-based and young people-focused innovations in 13 priority countries. This includes Romania, Tanzania, Colombia, Ecuador, Ghana, Senegal, India, Morocco, Egypt, Indonesia, Pakistan, Sierra Leone, and Vietnam. These countries were selected for their fast-growing urban environments and are a special focus of interest for the initiative. Over the next 7 years, Being will seek to create supportive communities and bring system-level change in priority countries and selected cities through a strategic and coordinated approach. Being includes a number of parts. So we have the networking, research, innovation, policy and advocacy, and youth engagement. The request for proposal is really the starting point of Being. It is the research aspect, and it is the opportunity for collaboration to analyze the local mental health and well-being needs of young people. Being is looking for this opportunities, for this request for proposal. We're looking for researchers, groups or organizations based in low and middle income countries. We're looking for these organizations to use the relational approach to well-being framework to analyze the local information on young people's mental health and well-being, and as a second part, to lead stakeholder and network engagement to scope opportunities for investment and collaboration. So I do want to point out that this opportunity, this call for proposal, is different than other opportunities we've launched at Grand Challenges Canada. We are looking for researchers or organizations to actually identify, analyze the information that's currently available on young people's mental health in these priority countries, and then bring all stakeholders together to identify the gaps in information and also to network. So the purpose of this request for proposal is to understand the local needs, personal, societal, environmental, and other drivers impacting the mental well-being of young people aged 10 to 24 in the 13 priority countries. The purpose is to leverage these findings that the teams will identify to help determine the next phase of funding for Being, and identify opportunities to analyze change for young people's well-being through consensus building. The purpose of the request for proposal and the work that these teams will be doing is to engage organizations, partners, networks relevant to young people's mental health and well-being at the local and national levels. And in terms of engagement, we want this to be beyond the health sector. So engaging different partners, different existing organizations and networks that are already involved in the mental health of young people in the specific countries we're discussing. The objectives of this request for proposal is, there's a few of them. There's two parts. The first part is to summarize and synthesize available evidence and available mental health information on young people in the priority countries. And then it's to identify the gaps in evidence regarding the mental health among young people and highlight future opportunities. So really highlighting where the gaps are, and then conducting stakeholder consultations to fill in those information gaps and identify priority research and intervention needs that will help inform the next funding phase of the initiative being. And lastly, it's also to bring together diverse interest groups to help identify a mental health agenda and potential to catalyze change in the countries of interest. So going beyond the health sector, we want diverse interest groups to be involved in this process, ranging from young people with lived experience to relevant government representatives and to different sectors. So the geographic focus of this funding opportunity is in all proposals that we're expecting should focus on the analysis of available mental health information in one or more of the 13 priority countries that I had listed earlier. So Colombia, Ecuador, Egypt, Ghana, India with a focus on 2 states, Indonesia, Morocco, Pakistan, Romania, Senegal, Sierra Leone, Tanzania, and Vietnam. So essentially all proposals that we are looking for should have the work focused in one of these 13 priority countries. However, the eligible entities that are able to apply should be based in a lower middle income country or be in a partnership with the lead entity based in a lower middle income country. So essentially the work must be done in one of the 13 priority countries. However, the entity could be based in any of the lower middle income country or be in partnership with one. The timeline for this work will be 9 months for single country bids or 12 months for multi-country bids, meaning that if a proposal comes through and is proposing to conduct work in 3 out of the 13 priority countries, they will have 12 months for multi-country, for their bid, for their work to be completed. So just to go over this, in terms of eligible institutions that are able to apply, the entity must be based in a lower or middle income country or be in a partnership with the lead entity based in an LMIC country. You must submit a complete application, which entails the following. So all required information in the technical and financial bid should be submitted. Technical bid should not exceed 10 pages, including the cover sheet and any appendices requested. And lastly, should be submitted in English or French. The geographic scope is, as I previously mentioned, should be focused on conducting an analysis in one or more of the 13 priority countries. Thank you. Okay, next, so in the request for proposal document that we had shared widely online, we've identified the scope of work for applicants. So the scope of work is clearly presented, and we'd like to go over that now and discuss the 2 main components. So the first component is the analysis of available mental health information on young people. So to clarify, this is where the analysis and the dissemination of all current available information should be done. So this is really where the desk work, the desk research is conducted. And then the second component is where you go beyond the desk research. So you take what you've found and what's available in the country, and then you want to move on to stakeholder engagement, consultation, and network strengthening. And what that means is, once you've done your analysis in the first component, then you want to take that and you identify the gaps, and you want to engage individuals who are, experts in the field to fill in those gaps. You want to engage these stakeholders from different sectors and start consultation and network strengthening. So to go specifically into component 1, the 2 components that were identified should be clearly presented in your proposal. So the first one is the analysis of available mental health, which should be approximately 20% of your total time and effort. The purpose of it is to collect evidence and identify gaps in information regarding mental health among young people. So it includes information regarding the well-being drivers of mental health, engagement of young people, mental health innovations, and pathway to scale and mental health key stakeholders. The overall aim is to use the collected information in this component as a starting point for discussion for component 2, where the engagement of stakeholders starts. So the outcome that is expected out of component 1 is a preliminary country profile analysis. So the first one is visual mapping. We expect applicants to develop a local visual mental health ecosystem map that identifies key stakeholders, drivers, services, and relationships, and the connection between these groups, and a gap analysis of available information to identify gaps in information that may be necessary for moving the mental health agenda forward in countries of focus. This could be a formal or informal analysis. Component 2 has 2 parts, but the overall purpose of component 2 is to start the conversation and to fill in the gaps by these key stakeholders. So invitation of key stakeholders from a variety of sectors, organizations, as well as individuals to share and discuss their perception about the collected information, with a huge emphasis on filling the information gaps that was not available in the first section or in the first component. So anything that was not available through literature should be enriched and filled in through this evidence gathering exercise in component 2 with stakeholders. The convening of key stakeholders will serve as a starting point for connecting mental health networks in the countries of focus. Key stakeholders should include those beyond the health sector to reflect the mental health infrastructure of each country. So what we're really asking for component 2, which is the majority of the work that will be conducted in the 9 or 12 months, depending on the bid that you're submitting, it is 80% of the total time or effort in this work. So what we're asking teams to do is ground engagement and consultations. When you're conducting these ground engagement and consultations, it's to help us determine where and what we should fund and who should be involved in this process for being. So it's really identifying the mental health agenda for moving forward and key funding areas that we should focus on, along with who the key actors that should be involved in the process. So the first part of component 2, the objective, which is the stakeholder engagement and consultation, is to convene stakeholder groups to better understand collected materials and gaps in information from component 1. This objective is meant to build on and expand on evidence gathered in component 1 from the desk research to add on additional information that was not available through literature. The context-driven research questions of interest to public sector's partners should be identified at this phase, as well as existing and new ideas for mental health innovations that can be scaled to improve the effectiveness of mental health programming moving forward. Objective 2 is to gather insights from key mental health stakeholders regarding their interests, expertise, readiness to take action, and willingness to collaborate with other stakeholders to move the mental health agenda forward. So the outcomes of this part will be midterm reports, so stakeholder to identify the stakeholder perspective on the existing evidence and gaps in knowledge, and also stakeholder interests, expertise, readiness, and willingness to take action and collaborate with other stakeholders should be identified. The second part of component 2 is network strengthening. So key stakeholders will determine how to best strengthen existing networks and collaborate to develop and nurture community and leadership support for addressing mental health issues in the countries of focus. More specifically, the team will facilitate consensus building among existing key stakeholders. So by working or supporting lead stakeholder engaged in mental health to identify priorities for research and innovative interventions to initiate and catalyze change. Consensus building may occur in a variety of ways using different approaches, surveys, methods, Delphi approach, and should be employed to facilitate the consensus building process among these stakeholders that you've identified and engaged in the process. So objective 1 is to consult, the objective of this phase is to consult with key stakeholders to assess and prioritize needs, barriers, and steps to catalyze change. Some areas to consider would be forecasting needs and opportunities in the mental health space, future opportunities, and recommendations. So the outcome of component 2B is consensus building outcomes. So to highlight pressing current and future needs and opportunities, priority next steps, and how best to disseminate identified recommendations. So next, I will go into some of the submission requirements that will be useful for when you're preparing your application. So in terms of the submission requirements, there's two big categories. The first is the technical bid, which should demonstrate your understanding of the requirements described in the bid solicitation, as well as demonstrate how the requirements of the evaluation criteria and the basis of selection will be met, as described in Appendix B of the request for proposal document we've shared. The technical bid should not exceed 10 pages, including the cover sheet and any appendices required. So you are responsible to submit all required items identified in the request for proposal document, along with a description of how the components that I had just discussed will be met throughout the duration of the project. The second part of the submission should be your financial bid, in which you must submit a financial bid in accordance with the basis of fee attached in Appendix C, and the total amount of any taxes, goods, or services should be shown separately. This should all be demonstrated and shown in Canadian dollars. So the mandatory criteria, in addition to those elements described above, the bidder should also provide basis of fee, which will be evaluated separately, and bidders are required to provide their estimated fees in Canadian dollars, excluding applicable taxes for each deliverable identified, and bidders are requested to provide the hourly fee for personnel involved in delivering the proposed deliverables. History of the firm and location. So any affiliation with relevant partners or network size should be shared in the bid. Description of support teams, so including biographies, relevant experience, and specific expertise that the individual will bring to this role. This section should demonstrate the ability of the firm to deliver the specific items outlined in the deliverable list that we've identified in Appendix A. And a description of support process should also be included. So this should include specifics regarding the level of responsiveness that GCC can expect on a regular basis. This section should include detailed about the measure in place for when primary contact support staff are not available. And then 2 client references are to be provided. So to just clarify this, as we've had a number of questions about this, the references, it's just the contacts that we are requesting to be included in the technical bid, not the actual reference letters. And lastly, the value added services. So anything that your organization thinks is necessary for us to understand how you are able to meet the objectives of this proposal. So anything you want to add about your expertise or ability to achieve the scope of work. So each bid will be scored using the scoring rubric, which has been provided in the request for proposal. You will be scored on 3 different areas. First, it will be the experience, which was worth 40% of the overall score, which is to determine whether the bidder outlines relevant functional or technical, sectorial, and geographic expertise. Second one will be based on the fees, so where the scope of work of the proposed work and funds requested are reasonable and align with the proposed goal. And lastly, ability to achieve program goals. So whether the proposal shows strong feasibility to achieve key deliverables on schedule and engage relevant stakeholders, including youth, public and private sector, and deliver final research outputs. So the evaluation criteria. So I'll go through some of what a successful application will look like. So a successful applicant will demonstrate the following: functional expertise needed to accomplish the proposed goals, the proposed deliverables, technical expertise needed to accomplish the proposed deliverables on youth mental health, sectorial expertise needed to demonstrate understanding of local and national stakeholders, strategies, and developments within the field, geographic or location-based expertise needed to accomplish the proposed deliverables, an understanding of global and local external stakeholders, strategies, and developments within the mental health field, previous experience working effectively within complex governance structures, capacity to deliver on objectives in an effective manner and result-driven manner, clear management and accountability structure within the team. A successful applicant should also demonstrate strong feasibility to move forward the key deliverables on schedule. So ability to engage relevant stakeholders, including youth, public and private sector, and deliver final research reports. Understanding and plan to conduct key activities needed to achieve key deliverables, value-added services that will help achieve proposed activities and deliverables to help the Being initiative, and clear engagement of relevant stakeholders, including specific focus on people with lived experience and young people with appropriate safeguarding mechanisms in place. So next we'll move on to tips for your application for when you're preparing your application. Be sure to review all bid requirements outlined in the request for proposal. There's a lot of information there and it is laid out for your benefit. So ensure all items requested are submitted. Ensure that you demonstrate in your technical bid that you have an understanding of the statement work and the required deliverables and timeline outlined in Appendix A, and ensure to include all components of the scope of work in the proposed plan, along with a description of how each component will be conducted. In terms of the format, we strongly recommend the use of subheadings to identify the different parts that you are trying to portray. And please do not exceed the page limit of the technical bid, as your bid could be, the page limit is 10 pages for the technical bid. So please do not exceed that. And lastly, for the financial bid, we ask that you provide estimated fees in Canadian dollars, and the total amount of any applicable taxes should be shown separately, along with providing hourly fee for personnel involved. Okay. So next we'll move on to timeline. So the application deadline is November 17th at 5 p.m. EST. The eligibility screen and review process will be conducted in November, and then negotiations between successful applicants and GCC will take place between November and December 2022, and the anticipated project start date will be in January 2023. So in terms of the deadline on November 17th, we do ask all applicants to send the bid package to the contracting authority outlined in the request for proposal, which is the globalmentalhealth@grandchallenges.ca email. Any bids that are received, but to another email or to another person, will not be accepted. So kindly forward your bid package to this email outlined. We so in the chat and along with our future outreach, we will also share some of these reference documents. So we do have the request for proposal available in both English and French. We will also share a frequently asked questions document on our website as soon as probably by tomorrow, just to ensure that all questions asked are included, commonly asked questions. So thank you so much for listening, and I'm glad we're about the halfway point of this session. So I am going to stop recording, and then we are happy to take any questions that haven't been responded to in the chat or still coming up. So just one second.